Tonight on the program, the second to the highest alert level is up in 4 provinces. Government schedules the vaccination of children. Health experts give tips on how to better prepare them for the shots. And a tearful Adele apologizes for the postponement of her series of concerts in Las Vegas. 4 provinces are now under the second to the highest alert level until the end of the month as COVID-19 cases surge outside Metro Manila. The government has declared alert level 4 in Kalinga, Ifugao, Mountain Province, and Northern Samar. This automatically limits movement of people below 18 years old and above 65, except for essential goods and services. Also restricted to go out are pregnant women and those with underlying illnesses. Mass gatherings, staycations, indoor and outdoor recreational activities are not allowed. Here now is a list of 15 areas under Alert Level 3. The Octa Research Group says nationwide daily cases will remain at the 30,000 level in the coming days because of rising infections in the provinces. But cases in Metro Manila are on the decline at over 9,000 yesterday, down by half from 18,000 last week.
If the trends continue, we're projecting about 2,000 cases, more or less 2,000 to 3,000 by the end of this month. Hopefully by Valentine's Day, it will be down to about 1,000 cases per day in NCR. And by the end of February, these are my new projections, it could be down to about less than 500.
Today, the Health Department recorded over 32,000 new cases with 156 additional deaths and more than 16,000 recoveries. Active cases are at a new all-time high, above 291,000. Health Undersecretary Rosario Vergeres says it is too early to tell if cases have peaked in Metro Manila, as the number of people who turn out positive in tests remains high. COVID-19 is the second leading cause of death among Filipinos in 2021, according to data from the Philippine Statistics Authority. The government plans to get more pharmacies and clinics to help provide booster shots against COVID-19, as hundreds showed up during its rollout in Metro Manila. We have more now from Stanley Gahete.
On its second day, more pharmacies and clinics joined the pilot testing for the rollout of COVID-19 booster shots. This is part of the government's effort to increase the number of vaccinated individuals by making the vaccines more accessible and available to the public. Vaccine czar Carlito Galvez Jr. said they tapped different private pharmacies and health clinics in Metro Manila to hasten the COVID-19 inoculation since many health workers now are affected by the Omicron variant. Qualimed Clinic in Makati accepted the initial rollout of booster shots.
Mas mabilis since dito ako nag-work, so dito na ako dumirect.
Different pharmacies and clinics in Metro Manila. Vaccine czar Carlito Galvez says they are in direct contact with these establishments for the continuous supply of vaccines and syringes. Galvez said their initial assessment of the rollout was successful since the public accepted the program. The National Task Force Against COVID-19 targets to limit the booster shots to only 50 individuals per pharmacy or clinic, but this could exceed depending on the demand.
After 2 years, there is a solution, and there is supply. There's overflowing supply, and there is access.
The government plans to expand this to more drugstores nationwide soon. Other countries have also adopted this strategy to fight the increasing COVID-19 cases. Booster shots are now available in different selected pharmacies and centers. For now, they prioritize A1 to A5 groups age 18 and up, or members of the adult population, but majority should come from the A4 working group. However, senior citizens and individuals with comorbidities are not included for now. Even those who have not yet finished their second doses and those who are age 70 below are not allowed.
So meron siyang tinatawag na regular allocation and also special allocation para at least tuloy-tuloy yung pagbabakuna natin.
Galvez also said that 1.2 million COVID-19 vaccines from Pfizer will arrive at the end of the month. 780,000 are allotted for children. And on the first week of February, another 1.6 million will come. By that time, they will also start vaccinating children aged 5 to 11. Stanley Gahete, CNN Philippines.
A social weather station survey shows vaccine hesitancy among Filipinos has gone down. The poll from December 12 to 16 last year, with 1,440 respondents, says those who refuse to get COVID-19 vaccines dropped to 8%, the lowest recorded since May to September. Malacanang believes information campaigns led to the continuous drop in vaccine hesitancy. Acting presidential spokesperson Carlo Nograles says the We Vax as One mobile vaccination drive will be brought to train stations, airports, and tollways in the coming days to make it more accessible to motorists and commuters. The government earlier announced COVID-19 vaccines will be available from January 24 to 28 at the Parañaque Integrated Terminal Exchange, where 500 doses of AstraZeneca vaccines will be available daily and walk-ins will be allowed. Health experts give advice on how to prepare children for inoculation as the government begins their COVID-19 vaccination next month. Paolo Barcelon has the details.
As the government prepares for the rollout of COVID-19 vaccines for children 5 to 11 years old, experts are giving parents advice on how they can help their children deal with this experience. Currently, the Philippines only allows the use of the Pfizer vaccines for children aged 5 to 11. It will be given in smaller doses, and their vials will have an orange cap instead of the purple ones used for adult doses. First and foremost, it is important to assure children that vaccines are safe and effective.
Kailangan maintindihan ng mga bata na ito ay proteksyon para sa kanila at sa mga kasama nila sa bahay. Kasama
Their time and be patient in explaining to children the vaccination process. This is because children may hesitate to go back for their second dose if they do not feel good when they get their first shot. It's also helpful to use terms such as getting a pinch instead of an injection to encourage children to get vaccinated. Children may also be shown videos or photos of vaccination to show them how it will be done. Come vaccination day, parents should prepare their kids' documents and bring them to the vaccination site. Make sure too that your kids are masked up.
Meron naman po maraming pwedeng sources of proof. If possible, to bring birth certificate, that's usually the best evidence. But there are also in our guidelines other list of possible evidences.
If your child is about to be vaccinated, try distracting them when they are about to be pinched. Asking your child to close their eyes may also help. Give your children comfort by either sitting or standing beside them during the shot. You can also hold their hand to dispel their fears. Ice packs may also help children who may experience pain after vaccination. After getting their dose, it pays to praise your child. Give them a small gift or token. The health department says part of the strategy to avoid confusion once young children start getting vaccinated is to have dedicated sites as well as vaccination teams and days catering only to children. Children with underlying illnesses should secure clearance from their doctors before getting their coronavirus shots. Paolo Barcelon, CNN Philippines.
Another change in the rules for our kababayans coming home, those who recently recovered from COVID-19 but still test positive in their pre-departure RT-PCR test may still enter the country, subject to certain requirements. The Pandemic Task Force says returning Filipinos should also present a medical certificate stating they have completed the mandatory isolation period and are no longer infectious and have been allowed free movement. Upon arrival, the traveler also needs to undergo facility-based quarantine.
Kung fully vaccinated at galing sa green list countries, territories, or jurisdictions, kailangan nila mag-facility-based quarantine prescribed for yellow list countries, territories, or jurisdictions for fully vaccinated arriving passengers.
The government earlier scrapped the mandatory quarantine for fully vaccinated travelers from green list countries. And straight ahead, The political party backed by President Rodrigo Duterte adopts a presidential daughter as its vice presidential candidate. But who will be their presidential bet? And state investigators arrest 5 suspects linked to the cyber hacking of a banking giant. Keep it right here on CNN Philippines. News you can use, news you can trust. Where we go local polls in May. The printing was scheduled last week, but due to some technical issues, COMELEC only started printing the first batch of the ballots last night. According to spokesman James Jimenez, the National Printing Office started the press work of 60,000 copies of the local absentee voters' ballots. The LAVs are manual ballots wherein the voter will have to manually write the names of their chosen candidates. These ballots will be used by those on duty on election day. After finishing the first 60,000 copies, COMELEC will then begin printing at least 80,000 more for registered Filipino voters abroad and for the Bangsamoro region. The poll body aims to print 67.4 million ballots on or before April 21, or exactly 3 months from now. Updates now on some 2022 aspirants. The Cusi-led faction of ruling party PDP Laban adopts Davao City Mayor Sara Duterte as its vice presidential bet. The wing led by Senator Manny Pacquiao, however, denounces the move, saying this is a desperate attempt to hold on to power. But for the camp of Duterte's running mate, Bongbong Marcos, the adoption by the ruling party deserves utmost respect. Labor leader Carlioli de Guzman wants to shorten working hours from 8 to 6 a day while still maintaining same benefits and wages. He says this is so millions of new jobs can be created. The Partido Lakas ng Masa standard bearer also proposed to impose a one-time 20% wealth tax on the country's top 500 families to finance his 1 trillion peso economic recovery plan. Senator Manny Pacquiao criticizes the Agriculture Department for saying that Typhoon Odette caused the fish shortage. Pacquiao says it was a lousy excuse to justify fish importation. He calls on the agency to extend aid to local fishermen. Supporters of Vice President Leni Robredo in Bicol urge their kababayans to remain calm amid news that 11 Bicol mayors have pledged to support Marcos. As of now, only 2 town mayors have expressed support for Robredo. The group is giving the other mayors until tomorrow to give their side on this matter. Senator Ping Lacson vows to carry out the criminal justice system fairly. Lacson also looked into the viral case of the 80-year-old man arrested for supposedly stealing mangoes in Pangasinan. The senator says the caretaker of the lot, a truck driver, has also become a victim as he cannot go to work because of bullying online. Lacson adds the caretaker is willing to settle, but asks this information be rectified. 5 people allegedly behind the massive hacking incident that targeted customers of Banco de Oro Unibank last year have been arrested. The National Bureau of Investigation said 2 of the suspects, both Nigerians, were caught in an entrapment operation in Mabalacat, Pampanga last January 18th. The 3 other suspects are Filipinos and were arrested in a separate operation. More than 700 BDO customers fell victim to a heist perpetrated by an unidentified group of hackers last December. BDO has yet to issue a statement. At the Manila North Harbor, nearly 100 passengers have been stranded because of the no vaccination, no ride rule. But it's possible they will get to travel by Monday. Philippine Ports Authority General Manager Jay Santiago told CNN Philippines. The port operator says it is coordinating with the shipping lines on the issue.
We will ensure that they will be able to board that vessel on Monday so that they will be in Zamboanga by late Monday or Tuesday. I have also instructed our port management office in Zamboanga to make representations to the city government of Zamboanga to allow them to proceed by way of exception out of humanitarian considerations and out of compassion.
Well, the passengers have been stranded since Monday and have been provided food and cash assistance, and some were given vaccines. The PPA calls on local governments to adopt common requirements and prevent confusion among travelers. Moving now to stranded overseas Filipino workers, an OFW group is calling for immediate assistance to those affected by the ongoing travel bans. Hong Kong and Taiwan have tightened restrictions on the entry of migrant workers amid a surge in cases fueled by the Omicron variant. Migrante International urges the government to provide stranded OFWs with a 10,000 peso cash aid and flight rebooking assistance, as well as free RT-PCR tests and temporary shelter in Metro Manila. Despite most Omicron cases being mild so far, the rise in hospitalizations and infection among health workers are also impacting services for other illnesses. Caroline Bonkin tells us among the most affected are dialysis patients.
At the age of 56, dialysis has been Ferdinand Miraña's lifeline. He's suffering from a stage 5 chronic kidney disease and diabetes, requiring him to go on dialysis twice a week. But he caught COVID-19 infection early this month. With hospitals full and short on staff amid the latest surge, Ferdinand's daughter says it was hard to find a dialysis center for COVID patients.
Try po akong tumawag sa one hospital po man, pero 1 week na po, wala pa rin po talagang nakahanap ng hospital para sa kay Papa.
For 2 weeks, Ferdinand didn't get his life support treatment. He was at home waiting to find a hospital. A friend lent them oxygen supply to help ease his symptoms. For a dialysis patient, a missed treatment could be life-threatening.
Sobrang malas na ni Papa, hirap na rin po siyang huminga. Akala po namin bibitaw na.
They recently found a private COVID dialysis center, but their next hurdle is payment. Dialysis for COVID patients is more than triple the usual 2,000 pesos they pay per regular treatment with PhilHealth. At private centers, it costs at least 8,000 pesos.
Kaya po sobrang hirap kami kasi syempre dalawa lang po kami katrabaho sa pamilya. Medyo kailangan po talaga namin pumayod para lang ma-reach po yung 8,000 po na kada session po. Kaya siya ganun kamahal kasi po yung ranger din po na kinakaharap ng mga nag-a-assist po ng mga sa nurse ng dialysis center po. Kaya ganun daw po kataas.
The National Kidney and Transplant Institute has been full in the past 2 weeks and is now referring patients to other dialysis centers. Over 500 health workers are under quarantine, so they had to close down 7 units with 150 beds.
Number of cases, pero yung mga
For special PhilHealth care rate for dialysis patients, better coordination to help find vacant dialysis centers, and to help lower the cost of treatment.
Hanggat maaari po agaran kasi hindi pa po talaga, hindi po sila namamatay sa COVID namamatay po sila kasi hindi sila nakakapag-dialysis. Hindi lang po kami mga dialysis patient yung apektado, pati po yung mga may cancer na nagkikimo.
CNN Philippines relayed the dialysis patients' concern to DOH and is still waiting for their response. Caroline Bongkin, CNN Philippines.
Returning now to our lead story at this hour, Northern Samar is under alert level 4 until the end of the month due to higher COVID-19 transmission and healthcare occupancy issues. For more on the situation there, we go above and beyond the headlines with Dr. Ninfa Camarosocam, Northern Samar Provincial Health Officer. Doctor, thank you so much for joining us. Kamusta po ang situation ngayon sa Northern Samar? Ilan po ang mga kasong naitala ninyo ngayon?
Sa araw na ngayon po ay we have 455, which is an increase from our 359 from yesterday.
And
But our hospitalization has gone down from 69 to around 47 today.
And ilan po ang mga ospital sa Northern Samar are attending to these COVID cases?
Ang provincial hospital po, yun ang level 1. Ito po yung pwedeng mag-admit ng mga moderate cases. And then we have another level 1, which is 50-bed capacity. And then we have 7 other district hospitals na 10-bed capacity siya.
And among these cases that you have seen over the past week, no, Doktora, are there more patients admitted and needing critical care, or are there more mild to moderate patients isolating at home?
We have more mild to moderate, but the thing is, no, we have more incidental, I would say incidental COVID patients. Ba't ko nasabing incidental? Pumunta sila sa hospital not because they're having symptoms of COVID, no? But ito ay manganganak. Ito ay na-aksidente. It so happened that we did a swab and then nag-positive sila. So, diretso sila sa COVID ward. So, konti lang yung talagang pumupunta dito sa amin for COVID signs and symptoms. In fact, no, nung kataasan ng aming cases, no, I guess the highest that we have at the provincial hospital is 650. Aanim lang yung talagang nag-moderate na nangailangan ng oxygen. So we're seeing more and more mild cases.
And these mild cases, no, most of them are isolating at home. Monitor niyo po ba itong mga patients who have COVID in their respective residences?
Ang mga municipal, no, ang municipal LGUs, ang mga RHUs, rural health units, ito yung nag-monitor sa kanila. As far as the provincial hospital is concerned, we are monitoring those na na-admit dito sa aming COVID ward and our healthcare professionals who are in our isolation facility. So, in terms of monitoring, yes, we do in terms of the numbers, no? How many are in isolation or in quarantine in different municipalities.
Doktora, yung Department of Health Eastern Visayas came out with an advisory, no? Northern Samar is part of Eastern Visayas. And they mentioned in their advisory about the reactivation of COVID-19 surge capacity and the increase of dedicated beds in all healthcare facilities. Kung marami itong more mild cases rather than severe cases, hindi po kailangan ito.
Kasi po, tulad ng sinabi ko, napakarami ng incidental, no? They came to the hospital not because they're having signs and symptoms of COVID, but because eto nga nanganak, no? Vehicular accidents, urinary tract infection, and other medical cases. Since it is our protocol, no? Na lahat ng ina-admit dito ay sinaswab. So it turned out that they're positive. So kaya napupunta sila sa aming COVID ward. As I've said, no, hindi karamihan na na-admit namin are because they are COVID-related signs and symptoms na reason for admission.
So importante rin po itong reactivation, no, ng Department of Health Eastern Visayas. Tungkol po sa bakuna, how many now are fully vaccinated in Northern Samar and have been boosted?
I don't have the exact figures right now nung nagkaroon ng booster, no? But as of Monday, no, nasa 69% yung aming vaccination rate.
And are there still people, our kababayans in Northern Samar who are refusing to get vaccinated? Meron pa bang vaccine hesitancy?
Oh yes, definitely, no? Merong iba dyan na grupo because of religious beliefs. Meron naman dahil itong mga to ay talagang nasa mga tinatawag natin GDA areas, no? So difficult to go there. But nung na-impose yung hindi na pwedeng pumasok sa mga different establishments, ngayon dinadagsa ang aming mga rural health units, yung aming mga vaccination centers, no? Dati kami naghahanap ng babakunahan, ngayon sila naghahanap ng bakuna.
And how are you convincing them po to get vaccinated and get protected from COVID-19?
Marami tayong meron tayong mga radio plugs, meron tayong mga pinapalabas ng aming Provincial Information Office. But as I've said, no, because inimpose na ng mga local government units, yung hindi pwedeng pumasok sa mga government and private establishments, yung walang bakuna, tsaka yung sa workplace, hindi pwedeng pumasok, no, kung wala ka hindi ka rin fully vaccinated, or in the absence of vaccination, you have to have your RT-PCR or rapid antigen at your own expense. Mukhang it's working, no? Hindi na namin kailangan kumbinsihin, sila na mismo ang nagpapabakuna.
Ayan, you mentioned po about testing, no? Do you think that there's sufficient tracing and testing in Northern Samar para makita po natin yung gravity, yung laki nitong Omicron or Delta sa probinsya? All right, we've lost our connection to Dr. Ninfa Kam, and we would like to thank her for joining us on Newsnight. That was Dr. Ninfa Caparoso Kam, Provincial Health Officer from Town. In Tears Online, keep it right here on CNN Philippines. News you can trust. Glad you're staying with us on Newsnight. COVID-19 pushes back British singer Adele's Las Vegas residency on the eve of opening night. An emotional Adele apologized to fans on Instagram, saying that half of her team caught the virus. Tickets for the show sold out in 6 hours back in December.
I'm so upset and I'm really embarrassed, and I'm so sorry to everyone that travelled again. I'm really, really sorry. I'm really sorry. We're on it. We're going to reschedule all of the dates. We're on it right now.
In a concert residency, an artist holds a series of shows in an exclusive venue. Adele's was scheduled to last until April 16th at Caesars Palace Hotel. Well, plans have been laid out for a new film studio that will get Hollywood stars a lot closer to the actual stars above. Well, Variety magazine reports that Space Entertainment Enterprise, or SEE, the company co-producing Tom Cruise's upcoming space movie, is set to launch a zero-gravity production studio. SEE wants the module to also contain a sports and entertainment arena and a content studio, all in outer space. Well, it's called SEE-1, and the company plans to build it by December 2024. That will be awesome. A studio in space. And that's it for now. Join me again on The Final Word at 9 tonight. I'm Rico Hizon for Newsnight, where we go above and beyond the headlines. Good night.